To Sarah.
All right. Well, we're talking about your pets this morning and bone tumors in your pets. Dr. Jerome Williams and Jillian is here, along with Dr. Tony Ballagas to talk about all this. Good to have both of you here today.
So good to be here.
Jillian is such a wonderful ambassador.
Yes, she is. And she loves you so.
She does. So look, this is really serious. A lot of people don't know about bone tumors for dogs and all those other things. So talk about that for a moment. When do you actually start referring somebody to Dr. Ballagas?
When I have a case that just beyond my level of expertise, if I can't get the diagnosis but need surgery, then I refer to a specialist like Dr. Ballagas.
Okay, so doctor?
Yeah, bone tumors are a very common thing that we see, and oftentimes they're seen in older dogs, and they typically start out with a subtle lameness.
Okay, you sent some pictures in, so
yeah,
let's
we got
go
some
through
pictures.
them.
These are some exaggerated cases, make it easy to see on X-ray. But some of these cases start out pretty subtle, and they're older dogs, and people oftentimes we'll think their patient's getting older and it's just arthritis, but oftentimes we'll find that in these cases there's a progressive disease, a very malignant disease. This case here, the circle's kind of gotten moved over, but if you slide that circle over to the right, you see the bone that's being destroyed, the dark areas of bone within the inside that circle. That's where the tumor has eaten the bone away, and the arrows are pointing to the periosteal reaction, a reaction of bone. As the bone gets eaten away, the body tries to stabilize this area, lays down new bone. Sometimes a bone tumor will even produce bone.
And that image on the right, is that just a side view?
That's a side view,
okay.
And the one on the left is a front to back view. So that bone should be straight. Most common places we see these bone tumors are in the long bones. It's oftentimes an osteosarcoma, which is a primary tumor of bone. 85% of them are primary tumors of bone. This is one that's not quite as exaggerated as the other, but you can see the reaction of bone, the swelling, the destruction of bone within the circle.
Sometimes it's hard to differentiate that from arthritis initially.
Well, sometimes that's why these patients, oftentimes the average age is about 8 years of age. And so it can happen in any age dog, but oftentimes they're older patients. This is a dog who had a bone tumor that destroyed enough bone that the bone actually broke. It's called a considered pathological fracture. So as it progresses, we'll oftentimes be able to see these changes. Early on in the disease process, you may not be able to see any changes. And so if you have a patient who's not responding to normal treatments for arthritis, oftentimes this is thought of as an arthritic patient. For 2 to 4 weeks of anti-inflammatories arrest, not getting better, you may want to get them reevaluated. We see these quite often.
So this is curable?
It's not necessarily curable, but can be treated. Okay, if left alone, these dogs live an average of 3 to 6 months.
Wow.
And, now the
what causes these tumors?
Well, it's like any other tumor. You know, it's the normal cells that begin to divide and are not regulated by the body. So sometimes it's at an area where there was previous trauma, and other times there's no history of trauma in these areas. Like again, we see it in even dogs as young as 1 year of age.
So Dr. Williams, when you see these patients, do you see a protrusion in their legs, or how do you know it?
It depends on the breed, depends on the location. And if we do an X-ray and we see something abnormal, unusual, what we want to do is take a chest X-ray and see if it's spread to other parts of the body, the chest being the most usual first place we'd see it. And if it's something that is operable, we may call guys like Tony to actually surgically remove that, if it's a limb, to surgically remove that limb.
Wow.
So treatment options range, I mean, depending on the patients, anywhere from the gold standard treatment, if they're indicated in these patients, amputation, chemotherapy, but more than 50% of dogs are doing well at a year with that treatment. 20% still doing well at 2 years versus dogs that may not be candidates for amputation, and you do things like palliative radiation or just treat them for pain and discomfort and buy as much time as you can.
Dr. Ballagas, thank you so much, and Dr. Williams, as always, thanks for coming, and always.
Thanks for capturing my dog. I mean, she just when she comes in,
wow,
she just bounces over to you.
I can't control that. Let's go to JJ.